welcome to Valley Life. I'm Rich Krebs, and I'm standing in the Horizon Health Center, the Subacute Center. And I tell you what, dude, this place is great. We've had some great tours of the facility, talking with Ashley and Teresa, too. I've met some great patients here, but I tell you what's really important is the amount of care and the quality specialists that they have on site to make sure you get back to you and get back to enjoying your life at the best of your ability. Mr. Mike Rosander, how are you, sir?
How you doing, Rich? Nice to meet you.
As a physical therapy assistant, your job is take people from any kind of debilitating fall or issue that they may be recovering from right now and get them back to tip-top shape where they can go back home and enjoy their life again.
That's correct. We see a lot of patients coming in from the hospital, and it's a lot of our therapists' goal not only to get them back to their prior level of function, but to get them back better than they were before they went to the acute hospital.
Part of the problem, too, in the job that you face is lots of times when people do have a debilitating issue, let's say they've broken a hip or a shoulder or something along that line, and they're thinking, you know, if it's a later stage in life, they're like, I don't know that I can actually put the work in that's going to require to get back, and I don't know that I'll ever get back. And it's got to be fun for you when you realize, when you get these people moving, to see that light go off in their head thinking, hang on, I might even be stronger than I was 10 years ago once they've had proper treatment.
That's right, and that's where the rewarding part of the job comes in. It's you know, like I said, we want to get them back to their prior level of function, and it's an enjoyment to see them walk out of here rather than being wheeled in a gurney. And
that's kind of the goal, too, at the Horizon Health and Subacute Center, is not just that you're coming here because you're going to be stuck for the rest of your life. It's getting you back as quickly as possible to where you need to be.
It's short-term care, and on average, our Medicare patients stay here around 28 to 30 days. Now, depending on the diagnosis, it might be a little bit longer. If you have a severe stroke or something of that nature, you might be here for around 45 days. But nothing is in concrete here, so you know, it's really good that they come in, they work hard, and we try to get them on their feet and back us home as soon as possible.
Right. And Mike, watching some of the other professionals too work with patients, and most of them on a one-on-one basis, you're using so many different techniques too, and creating that muscle confusion, and also getting the different stretching techniques and muscular output that is needed to get people back in rehab mode. But like we talked about earlier, a lot of these people probably end up leaving here well on a path to be stronger than they were 10 years ago.
That's right. We have a great staff here. We have 16 full-time employees. We have both occupational therapists, physical therapists, and then we also have speech therapists and respiratory therapists. Sure. So the different techniques that you see them doing, you know, that's their background. The occupational therapist primarily deals with the upper body, the arms, the hands, the dressing, the grooming, the bathing, things like that. And our physical therapists deal with the lower extremities, the walking, the transfers, you know, the bed mobility and things like that. So yeah, we've got a full circle of staff here that can take care of any kind of problem. And
being a specialist like you are too, you know, you've got to then diagnose what's going on and what are your main issues, and then fight through that, because each person's going to be different because they've got a different injury or a different road to recovery that they need to be on. So you've got to incorporate different techniques to get them back.
Correct. We see tons of different diagnoses here. We don't just specialize in one or two or three. So we are fully capable, and we have the machinery here to take care of all those different diagnoses, anywhere from hip replacements, knee replacements, all the way to pneumonia, urinary tract infections, you know, strokes. We deal with a lot of strokes here. So we have, you know, very, very good, high quality, state-of-the-art machinery here to take care of all that.
Looking at some of the equipment too that you've got, and also to the balance bars and the multi-function cable pulleys, and this is just one of the spots on the facility too that people can work out and start their rehab process.
And the nice thing is what you see in here right now, we also have another therapy room inside the facility that will be going under a construction here in maybe another month or so, and we plan on knocking out a wall, getting more of this equipment so we can make the room bigger and get more people going.
Good. And it's got to be fun too with the beautiful grounds that are here at Horizon. When people start realizing that they can get their lives back and get back to mobility, they can actually go out and enjoy it too, and they're not just stuck in a sterile, you know, the old clinical environment that people used to be in, because everything here is just more uplifted, beautiful colors where people can get in that mode of, hey, you know what, I am here to heal myself.
Yeah, this isn't your normal hospital or skilled nursing facility. This is one of the tops in the Central Valley, and the nice thing about having these nice grounds that we have is we're able to take the patients out there, work in different environments in which they're going to be facing when they get out of here. So yeah, we don't just stay inside the gyms or stay inside, you know, weather permitting. We like to get them outside, and we've got some stairs and curbs outside and some uneven surfaces to work on, and So yeah, we're not just staying inside the facility all the time.
And Mike, before we run out of time, too, centrally located between 3 major hospitals, too. We're at Herndon and Chestnut, so I mean, you couldn't have picked a better spot.
This is great location. Doctors' facilities are close nearby, so yeah, we've got the 3 major hospitals sending us patients here, and like I said, we're equipped to deal with any kind of diagnosis that they send us. So it's a really nice place.
Well, Mike, I'm going to get you back to putting smiles on those people's faces over there that are getting back. Thank you so much for your time. I sure appreciate it.
You got it.
Give them a call at the Horizon Health and Subacute Center, and I tell you what, it's all about getting you back to you. And as Mike was saying, you know, a lot of these people too are here less than a month to get back to enjoying their life the way they were before they had a fall, an injury, or any kind of rehabilitation they need. Don't go anywhere. There's more Valley Life coming up right after this.